Hello and welcome to India Top Doctor. Today we will be talking about technology and its benefit in healthcare sector. To talk that, we are going to invite Dr. Nishant Kanodia. He is a general practitioner at Vision and Life Care Clinic. He is also a professor and HOD of the Department of Internal Medicine at Shekhar Hospital and Hind Institute of Medical Sciences, Lucknow. He has 16 years of experience. He is dedicated to manage lifestyle disorders including hypertension, thyroid, and diabetes. He is also a specialist in infectious diseases and critical care, especially for dengue, swine, flu, and coronavirus. So let's welcome him. Hey, welcome to India Top Doctor. As you know, today we'll be talking about the importance of technology in healthcare sector. So what is, according to you, digital healthcare?
So digital health is a specialty, broad specialty, in which the healthcare and the digital medium comes into one platform. They merges like two different poles apart, and a bridge is there to join them. So in this digital health, the healthcare is integrated with softwares, applications, hardwares, and many other things that all comes under one umbrella. It includes electronic health records in a good way. And other than that, it includes electronic medical devices, health applications, mobile health formats in which the patient gets a personalized care. So things are very good in that way.
All right. And how are you involved in digital healthcare?
My involvement as a healthcare personnel is that things are improving and are evolving. So I have to be in terms with the world. So to overcome many problems like pandemics related to aging, many diseases are there, mortalities. To overcome everything, it is very essential for me to upgrade and update my patients in a similar way. So digital health usually improves the ongoing transformation of healthcare into a digital format, and it is accessible to me and my patients in a very good way. Say my patient is in Bombay and I'm sitting in Lucknow, so I can communicate with my patient through a e-portal. I can treat them, I can watch them, and their progress is there with me all the time. There are certain devices I had discussed also in the platform in Mumbai also. There is a diabetes is one of the major problems. So continuous glucose monitoring system is a system where I can manage patients' glucose all throughout the day, all throughout the week, and all the data are with me always. So these are new devices, and because of that, my patients get a good improvement.
All right, and it sure has made a huge difference. So, sir, do you think digitalization has any way improved healthcare sector, and how other ways are there?
So the major role in the digitalization improvement in the healthcare is of artificial intelligence. So artificial intelligence is there for since 1950, but it came into existence after 1990s. Healthcare excellence or healthcare improvements through artificial intelligence, the major breakthrough is the innovations in creating the vaccines. So there was a time when the vaccines needs to be created in 6 to 10 years. Now, in a single year, we have created a lot of vaccines and prevented a lot of patients from COVID-19. So these breakthroughs to fight the diseases and to create new therapies is because of digital healthcare and through artificial intelligence. Other than that, there is a lot of big data that is being created by all around the world, say COVID-19 or maybe for cancer or AIDS patients or diabetes patients. These data is to be stored and is to be managed and is to be accessed by multiple societies and multiple organizations. So they definitely need a good thing like a blockchain so that the data can be preserved efficiently. It is secure and it is accessible. That happens because of artificial intelligence. then these data is to be operated by many staff are required. So there should not be any medication error, there should not be any staffing error or staffing deficiency. Staff are very less, they are working from home. So all these things has improved the healthcare. Lastly, digital literacy among the professionals, it is also improving. That is the main part. The people or the medical professionals are not accepting, like we are talking or from two different cities. So this digital literacy is to be accepted by everyone in a good way and as soon as possible. So these things have improved the healthcare sector.
And what problems can be addressed by digital healthcare or technology, as I say?
So the majority of the problems are the responsibility. Since responsibility is a major concern. Some people said that if something happens to a patient, who is responsible? A doctor is responsible, or a hospital is responsible, or whosoever is performed the things is responsible. So it is very difficult to say that who is responsible and who is not responsible. So the main question raises is of security and privacy concerns. How they are how these obstacles is to be tackled. So digital literacy definitely removes all the unequal access to the healthcare and to the patients and to the data storage in a good way. And these technology betters these problems. We have a lot of patients lying in the rural belt. They are not accessible. Telemedicine has helped them to reach to the doctor any part of the world. So these are some raised concerns. Other than that, infrastructure is a problem. Traveling to different places is a problem. You visit a doctor, you take his appointment, and you get back with the reports after 2 days or 3 days. Patient don't have time to stop there. So there are technologies that instantly you do everything at one point go. Even patient is sitting in Bihar and is communicating with a doctor in Mumbai or Jammu Kashmir or Kanyakumari. So these are many obstacles that technology has removed in the healthcare sector.
And according to you, sir, are there any obstacles for greater or better use of technology in healthcare?
Yes, still, digital literacy is one of the main concerns. Other than healthcare professionals, many other people all around the world and in India are not very well equipped with these digital formats. Yes, Wi-Fi is available, internet is available to many things. Still, people are lacking to reach the basic healthcare setup. Those basic healthcare setups are not well connected with the cities or the big things. So these things have to be removed. So Internet of Medical Things is one of such things that can remove these obstacles. It can save time, it can boost the accuracy and the efficiencies because of those technologies. And telehealth or telemedicine is one of those formats. We should provide small data like you or me are wearing a digital watch, so they can wear a digital mask or a watch, and their health, whatever is happening in their health, in their body, is directly perceived by a doctor, and doctor can approach in 5,000 or 50,000 patients in a single day by sitting at a single place. So it will be very easy for him to give access to everyone at the same time. Other than that, what I have discussed, that blockchain, electronic medical records are very essential to reduce any medical error, to access the preventive healthcare process, and to share everything with the audience.
What promising advancement do you see in point of care treatments?
In point of care treatments, well, I have said almost everything. So if we equipped good things to all the peoples that are available in a good way, they are accessible, then every patient has a tailor-made medical care. Their outcomes will be improved, their diseases will be low, their preventions will be on a higher side. And all these things like social networks, smartphones, they are definitely offer to improve the healthcare and the society a good providers substance, because main contributors or the stakeholders are the medical equipment makers. are doctors as well as patients. So to reduce any inefficiencies, to improve the access, to reduce the cost, to increase the quality, this digital healthcare in integration with artificial intelligence is very much required. In coming years, 5G will play a very important role, where 4G has limited speed, 5G has enormous speed, and it can connect worldwide very fastly and very frequently, even in the rural areas. VR tools, wearable medical devices that are very cheap and very accessible by every healthcare setup. They can streamline the use of all these AI-powered systems very efficiently. In last, I can only say that all these advancements will lead to the convergence of people, information, technology, connectivity to improve the healthcare for a better outcome.
Thank you so much, sir, for so many useful information. In the end, do you have any message for our audience?
Yeah, try to adopt the technologies that are evolving around you, and very frequently they are not dangerous, they are really helpful. Everything comes with a benefit and with a loss, but benefits are more than whatever you are losing. So even if your smartphone causes your data connectivity a bit cost, they are helpful. They are helpul in cases of emergencies. You can contact to the doctor very efficiently. If doctor is providing you a solution, then it will be helpful in whenever is you are required. So if you are living in a rural area, you have a net smartphone access or a normal access with the internet. So get used to the internet and all its connectivities and the things that are being provided by your doctor or whosoever is in the concern in the same area. Thank you.
Thank you so much, sir. It was really great talking to you.